Autoimmune hepatitis is a destructive liver disease. Fortunately, it is very rare, but let's look at what we can get out of vital substance or integrative medicine, in addition to conventional medicine. Autoimmune hepatitis is really rare. It affects only about 1 to 2 people per 100,000, 3 times more women than men, and it is not clear why. When we talk about hepatitis, we usually mean inflammation. The suffix itis means inflammation, and liver inflammation hepatitis are usually caused by viruses. You probably know hepatitis A, B, and C, which are distinguished because they are caused by different viruses. Autoimmune hepatitis has nothing to do with viruses. It is an autoimmune disease. And here we assume that the immune system directs itself against the liver and destroys it in the process. When autoimmune hepatitis is diagnosed, 1/3 of the patients already have a destroyed liver to such an extent that we speak of a liver cirrhosis. And this is no longer curable and cannot be reversed. The symptoms of this disease are upper abdominal pain. Here and below is the liver under the rib arc. Here you feel pressure and pain. People who suffer from this disease feel sick. Very important, the stool becomes brighter and the urine becomes darker. These are characteristics for this disease. The diagnosis is practically only made by biopsy. There is no other way. You must poke into the liver, take out a bit of the tissue, and look at that under the microscope. The therapy in conventional medicine are your standard drugs. In all autoimmune diseases, cortisone is applied. There is a drug called budesonide. It has quite a good effect. Then the azathioprine, or the brand name Imerec. It suppresses the immune system in a good way and not too limiting. Or the really new modern immunosuppressions medication. They are also called biologicals. They work well, but at the price of higher for other infections. From a vital substance medicine point of view, we have to weigh things up a bit here. What I always recommend for all liver diseases is zeolite. Zeolite is a volcanic rock that binds many toxins in the colon. When we take zeolite, we bind histamine, heavy metals, and ammonium in the gut, and therefore we relieve the liver from being overloaded with its work from removing toxins and having to fight the disease. We can also improve the liver function with bitter substances. It is worth going to the drugstore and buying any gall products. They contain a lot of bitter substances. Unfortunately, the bitter substances are bred out of our vegetables. That's part of the reason why we have more liver diseases today. The liver needs bitter substances to work healthily. You can look around the market. There are many such products available. Then, as with all autoimmune diseases, a gut treatment is part of the process. There is a link in the description below where you will find a website with information about intestinal diseases. Because in all autoimmune diseases, an unhealthy gut is ultimately the cause. That is where the immune system is disturbed, and that is why a co-treatment of the gut is always essential. Finally, you can use anti-inflammatory natural substances such as frankincense, reishi mushrooms, aronia berries, OPC, grapeseed extract, and so on. Whether that helps with hepatitis is not equally effective as with other inflammations, because the liver is usually already too far destroyed. Artemisia is a plant that has fantastic anti-inflammatory effects, can also be used as well. You see, there are many natural products available, but try to find a doctor that knows about these things.
Aber es braucht dazu einen Arzt, der sich mit diesen Vitalstoffen auskennt.